So what is it that annoys you about wearing glasses and contact lenses?
Really sick of having sore eyes from contact lenses all the time. And tired eyes are very sore eyes.
I was getting frustrated taking my kids swimming. I couldn't see them in the pool, from a distance of about half a metre, so I decided I'd had enough and I could do something about it.
I was lying in bed, I've got a lovely view, but I can't appreciate it because, I have to put my glasses on, or I can't lie back with my glasses because, it pokes funny and you can't watch the TV.
I guess it was mainly, I spend a lot of time outdoors, both for work and sort of for recreation, so things like rain on my glasses and getting all fogged up and things like that.
Going for a run, things like that, when you're working and you've got to take your glasses off again and put it back on, it's very annoying.
I'd spent a lot of time on buying contact lenses and getting frames, and glasses just didn't seem to work very well for the lifestyle with my children.
I had 2 children and I wanted to muck around with them and, interact with them the way I should, and these glasses I used to wear just got in the way all the time. Little babies love to grab them and pull them off, and so I thought, that I've been wanting to do it for years anyway.
It's a lot of work doing contact lenses all the time, a lot of preparation. I was really sick of it.
Just inconvenience, and I didn't feel attractive and vivacious and all those things with my contacts or my glasses.
The things that made me come here were, I guess I'd read about what the Fendalton Eye Clinic had to offer, and more specifically about the blade-free laser option, and I thought I would investigate that.
At Fendalton Eye Clinic in Christchurch, your days of dependence on glasses and contact lenses may now be over. Fendalton Eye Clinic specialises in today's latest techniques in corrective laser eye treatments featuring blade-free, high-definition LASIK. So why is LASIK so good?
LASIK remains the most popular eczema laser technique due to the fact that it isn't very painful afterwards, and most people can see well by the next day. Compare that to surface treatments, which is the alternative, where it can be painful, not always, but it can be, and visual recovery typically takes at least a week.
Dr. David Kent is a leader in the field of corrective eye treatments. He presents his work at major scientific meetings around the world and has gained international recognition for his work. Dr. Kent is the New Zealand representative to the International Society of Refractive Surgery, as well as the New Zealand representative for the Australasian Society of Cataract and Refractive Surgeons. At Fendalton Eye Clinic, Dr. Kent is able to correct a number of common eye focusing problems. Let's take a moment to investigate what some of these focusing errors are. At the front of the eye is the cornea, which acts as the primary focusing surface of the eye. Myopia, or short-sightedness, is where the eye is too long relative to the curvature of the cornea, causing the light rays to focus in front of the retina. When you're short-sighted, distant objects are blurry, whilst things become clearer as you move closer to them. Hyperopia, or far-sightedness, is where the curvature of the cornea is too flat relative to the length of the eye, causing the light rays to focus behind the retina. When you're far-sighted, your vision is often good until your 20s or 30s. Then you start to notice that objects are not clear close to you. Then you become aware that objects in the distance aren't clear either, eventually requiring spectacles to see things at all distances. Astigmatism is where the curvature of the cornea is different vertically than horizontally. Most eyes have some astigmatism. The profile of a cornea with astigmatism is more like that of a rugby ball compared to a soccer ball. With perfect sight, the cornea focuses light onto the retina so the image is sharp. It's the relationship between the curvature and length of the eye that determines how blurred your vision is. At Fendalton Eye Clinic, we're aiming for normal vision, free from the conditions we've just discussed. There are a number of corrective laser eye procedures that are available at Fendalton Eye Clinic to correct all these focusing errors. In fact, Dr. Kent's been a leader in bringing the latest technology to New Zealand since 1997.
Eczema laser technology has come quite a long way since we started doing it in 1997. Nowadays, we specialise in performing 100% customised or personalised treatments, so that every treatment we do is individually tailored to that particular eye.
At Fendalton Eye Clinic, we provide the very latest techniques in corrective laser eye treatments, providing high-definition laser technology. The LASIK procedure involves 2 steps. Firstly, a flap is made in the cornea. The older technique involves cutting the flap with a bladed instrument called a microkeratome. While some clinics still use the bladed microkeratome to cut the corneal flap, this superseded technique does not provide a high-definition result. At Fendalton Eye Clinic, Dr. Kent uses the intralaser laser to create the corneal flap. This is the only way to achieve high-definition LASIK. The second step of high-definition LASIK is where the excimer laser is used to sculpt the inner layers of the cornea. With high-definition LASIK, the excimer laser is programmed specifically for your eye, using iris recognition technology and wavefront mapping of the exact focusing characteristics of your eye. With high-definition LASIK, Dr. Ken and his team are committed to provide you with the precision, safety and accuracy of the most advanced technology available. What high-definition LASIK means to you is better results, less discomfort and a more predictable outcome for your eyes.
Intralaser has been a major advance in LASIK surgery, and the reason for that is it largely eliminates most of the complications that used to occur using a microkeratome. With a microkeratome, a steel blade is used to cut the LASIK flap, and with Intralase, that's done using a laser. It's a lot more accurate, a lot more precise, and the flap dimensions can be very carefully tailored to each individual patient.
Clinical studies have shown that more patients achieve vision that was 20/20 or better when the intralaser laser is used to make the corneal flap compared to the bladed microkeratome. And patients report a better quality of vision overall, particularly in terms of their ability to see well in low lights, such as at dusk or at night.
Although the LASIK technique has been around for about a decade now, it's never been approved for use in people with high visual demands, such as naval aviators and Air Force pilots. But just more recently, the precision and accuracy of the intralase has meant that that's now been approved, that those people, like Air Force pilots and US naval aviators, are allowed to have intralase LASIK. And just recently, NASA has come out and approved the use of intralase, blade-free or laser LASIK on astronauts. And this is exactly the same technology as we're now able to deliver here at Fendalton Eye Clinic.